Hello, good evening. This is News Board with me, Patricia Roxanne Hammond. Today we are at the Ga East Municipal Hospital. It's actually a Child Health Week promotion, and I have Dr. Nancy Ashaley. She's a general physician here at Ga East Municipal Hospital, and she will be telling us more about the child health and the theme around it and all about the celebration. Good evening, Mom.
Hello, good evening.
And welcome to News Board.
Thank you very much.
Yes, so tell us about the Child Health Promotion Week.
Okay, thank you very much once again. So this Child Health Promotion Week is actually a one-week annual celebration which is celebrated by Ghana Health Service, and it's done every year, actually from 9th to 13th of May each year. And this year's theme is centered on child safety and security.
Okay.
The idea or the essence of the Child Health Promotion Week is actually to look at how children of all age groups will be protected from risks of getting hurt or abused in any form. And it's also looking at identifying those risks and then appropriate ways of managing those risks.
Okay.
Yes, so that's basically the essence of the Child Health Promotion Week. So it's to draw public's attention on then the risks and then the abuses, whether physical, mental, social, or psychological.
Okay, okay.
Yes.
So this week, what are some of the programs lined up?
So basically, with Ghana Health Service, they have drawn out some schedule or some itinerary which will be carried out throughout the course of the week. Okay,
so this time around, let's concentrate on Ga East Municipal Hospital.
Okay, so basically because Ga East Municipal Hospital is also a sub or under, it falls under Ghana Health Service, so we are equally also celebrating and putting out certain itineraries to mark the one-week celebration. Okay. So some of the itineraries include child welfare services, okay, immunization, health talks, like this TV program or TV talk show, and then going to communities, yes. Okay. And then schools as well.
Okay, okay. So in terms of child safety, what is it? Can you educate us a bit?
Okay, so basically
everything about safety when it comes
yes,
to children.
So basically it's very broad.
Okay.
And because of that, it has been underlined or subdivided into various categories, so okay, we can handle or cover all of them in general. So we are looking at the environment, we are looking at road and crossing or road safety, we are looking at home care, we are also looking at hygiene, hand hygiene, and then medication. Okay. So that's how we have categorized them into. Okay. Yes.
Looking at if we say a child, at what age are we talking about?
So with WHO definition of who a child is, they gave an age range from 0 to 12 years. So any child from birth to 12 years is considered as medically as a child.
But Doc, from your definition, how do we identify some of the risk factors and how do we manage it?
Thank you very much. So identifying those risk factors is, I won't say it's easy, although it's also not difficult, because it all boils down to how often you spend time with your ward or okay, your child, and getting to know who your child is. Because you see, irrespective of the father, you might have more than a child. Each child is unique. Yeah. So what Amma goes or likes might not be the same for
as Kofi.
As Kofi, yes. So you need to be on the lookout, observe your child. But you have to get closer to getting to know your child very well. And because your child is also socializing, you see, when children start going out of the house, either to school, to church, they start socializing, they start making friends. So you also want to get to know their friends. It's not just getting to know your ward, but going beyond getting to know your ward and getting to know who your ward associates with. Now, also, if you know the vicinity in which you are living in, you should know where you keep your hazards. So your sharps, your chemicals, yes, should be out of reach for them. And then let the child know that this thing is not consumable. This thing, if you touch it, you might get hurt. You don't go closer to fire.
But with this, at what age do you give them that kind of education? Because I'm not sure a 1-year-old or a 2-year-old will understand, or will they?
No, but it's all funny how we communicate with even a 6 months or 7 months old child.
Okay.
Although we don't understand what they mean when they make those sounds or noise, but in a funny way or very interesting way, I think a toddler even understands when mommy says no, because sometimes you mimic certain sounds. Not to say they will understand everything vividly, but I think with time they tend to learn what you mean to communicate to them. And looking at children older than 6 months, so from 2 years, of course, they are walking, all things being equal. 2 years they are walking, they are running, they are going and coming. So you can start educating your world from there. When you go to the kitchen and you have a child, you can bring your child to the kitchen, tell your child this is a knife, it cuts you when you play with it, so you don't touch it. You
know, there is something about children from that age. They become very curious.
Yes.
So like they see the knife, because they've seen you cutting with it, they also want to do the same thing. They've seen you writing with a pen. When they see the pen, they like to scribble something either on a wall or maybe some of your documents, if you display it in the open for them to do.
Yes, that's interesting. And it's true, actually, because children learn, and they learn by observing. And you see, whatever they see you doing, they think it's safe for children. They don't know the difference between a risk or a hazard and then something that is safe for them. Yeah. So it's the duty of the parent or whoever is taking care of the child to let the child know the difference between the two. That notwithstanding, that doesn't mean you prevent the child from learning how to cut vegetables. But you see, there are toys made. You have toy knife, toy pot, whatever. If you can afford, you can, of course, buy some for your daughter or buy a football, plastic ball for your son. And then teach them where they can play safely, so that they don't go to the kitchen closer to the gas or closer to fire.
Okay. So now let's zero down to the internet. You know, it has become a norm now that children are becoming addicted to the phones or the tablets or television, the things we get for them. So they can go, take your phone, they can access YouTube, they can watch whatever thing they need to have, they want to watch, provided you have data, enough data for them. How do we help them, like, not to be open or not to be exposed to harmful information and attacks and all that?
Interestingly, you have children these days are very smart and very curious, and for whatever reason we can't really pin our mind to, but we realize that because of the way the system or the trend is moving this way these days, so you have kids or children who want to learn, and most of these children learn on the internet. The internet is good. Equally, it can also be a bad influence on children. But for kids, they don't know what they are looking for. All they want is they want to see rhyme, they want to learn poem, they want to watch cartoons. But you see, the moment they go on the internet, they are exposed to seeing all kinds of things that they are not supposed to be seeing. You find children mistakenly finding themselves on those pages. What I will advise is that parents need to streamline what children watch. They need to know what their children are actually doing on the phone. When you give a handset to your ward, make sure that the ward is actually using the phone as you want your child to be, what the child is using the phone for, not for any other thing.
You know, one thing too about watching cartoons or rhymes on the internet, when you go to that page and then you type the particular cartoon they want to watch, you give the phone to them. As and when certain things pop up, they don't know about it. They are curious. They'll click on it.
Okay.
And then by the time you realize, it takes them from from the previous thing you already, maybe they're watching like Tom and Jerry. By the time you realize something pops up, the child will by all means go click on it. And it's something else. So it's virtually, they deviate from the Tom and Jerry to something else, whilst in your mind, they're watching cartoons.
Okay. So this internet is also a means of advertisement, and you can't control what they
control it. Yes.
To advertise whilst you are on. So far as you on your data, they are coming up with all sorts of advertisements. Some are good, some are healthy, some are not. So I will not even advocate you giving a phone with your data turned on, which is actively working on internet to your ward. The best alternative is to either download whatever rhyme or cartoon or poem it is, or for whatever educational content you want your child to study. You can download that and put that on the tablet or the phone. You can even project it on the television and let your child watch in the hall, in the view of all, instead of the child being alone behind the phone and you have that's not advisable at all.
Okay, so now let's go to the baby, a day-old baby, how to care for them, keeping them safe in terms of their feeding, their health and other things, just to conclude.
Okay, so thank you. For care of children, so let me start with a fresh or a day-old baby. So we advocate a lot about hand hygiene.
Okay.
Because usually, not only necessarily for a fresh baby or newborn, but for all age group. As a matter of fact, hand hygiene should be part of our everyday life. Before you pick up a child, you should wash your hands with soap and water under running water.
Yeah.
Sorry. And then you keep your child in clean clothes and clean cot sheets. And we also advise parents to send their babies for child welfare services regularly. And then depending on when they are given an appointment, they should honor it and take the babies to child welfare services. Breastfeeding is what we advocate for. However, where in instances where mother is not available, mother is probably diseased, and the caretaker, whoever is taking care of the child, would want to fall on the formula. The proper handling of the baby's cutleries or cup or feeding bottle, whichever way you are using, should be handled properly. We usually ask that you use a liquid. We have a dishwashing liquid soap,
okay,
which is the ideal one you can use. And then you best sterilize it. These days, a sterilization tablet some can't afford. So you can alternatively boil hot water, a clean hot water after boiling. After you finish washing the utensils, the cup, the plate, the bowl, or the feeding bottle, whichever way, you now dip them into the boiled hot water and cover it down. So as and when you want to feed baby, you wash your hands under hygienic or aseptic soap conditioner, then you now go and start preparing the milk for the child.
Okay, so how long do you keep the bottle in the water?
So you can do that. You see, when you have the essence of it is to sterilize the utensils. So after you have done that, you can get a clean bucket or a bowl with a cover. And then you put it, after dipping it in the water for like 15 minutes, you bring it out and then put it in a clean bowl with a cover so that it can be there. Yes. Okay. And then aside from neonate or infants, where you are advocating for child welfare services, when children start growing, after that's from 1 year, from childbirth to 5 years, that's a very delicate period of every growing child. And this child is very, very important. And that's a period we have to be very skeptical and very careful about these children. But they are very vulnerable to developing all sorts of illness, and then they are vulnerable to accidents as well. So our attention should go on them more.
Mao manu no fusio fiti da obewono de kosibu suminsia enfa bibianka ho. Mao manu no fusio fiti da obewono de kosibu suminsia enfa bibianka ho. No fuso tete awontem, no fuso mankranyansa, no fuso ya mofradia, enya papa no dia. So tete awontem, no fuso mankranyansa, no fuso ya mofradia, enya papa no dia.
Me pamocho, nkola pomudie ehia pa. Na niema yede boa ema nkola enya pomudi pa. Abra wo akola efiri ye fumu no eye eduane na kola ye woni free ye fumu a eden ye di kan de ma no eye den eye nufunsuo esanse nufunsuo ewo niema hoden a ewuwom a emma ebon kola no ho ban efiri yare wanketu ebi hu nti no ye di kan ma omo nufunsuo ye free ho a odi akola ne ba weyin na ya ma omo indro ya wo indro na bon ho ban efi yare wan kitinkiti bi ho a ebetimi di ohaw abromo ana meboa ye free ho nso a omaduane biom a omudi se omunyi se ni omunyi nyina no nso no ye hwe ana meboa ye gusu a ye ka omapomudie ho asem apomudie aduane ankola ne di eka ho edi aduane na wode ma wo ba se mi kei min ka se uto fried rice ema wo ba enu na ekere se wo ma na aduane pa uto de ma mu de ma nkola no indomie enu na ekere se wo ma aduane pa de okonkomu no ba ko no mumbo moya de munim ena den biom mu wode e mototo mo ba sorry ne mo ko eye we na mo yi na mo ya kire ye eye de he ena de akanyina ye ka apomudia aduane a wode ma wo ba na wanya hoɔden aba wo ba no ho ban wo redie ni mu etimi ako etia yare ewa akola ne redie mu no eno na ye ka ho asem broni anase wo potoka sem ye obibi ye say balanced diet aduane a eye well balance aduane ewo aduane mu nyin emu niema ye say de ma enipa nyina no aduane mu ahoɔden niema ewo aduane mu no enu nti wo ma akola aduane a so hwɛ sɛ aduane a medi mani ahoɔden ben no benya eden no benya ewom broni besie nutrient ben vitamin ben eden na eya ma akola no enye si ye ma na aduane na wa men keke na wa ye di na wagya isu dabi akola aduane na mede ma no ebeboa no wo kwan ben so ebema wenye kuro woni yemu ana se ebema ne sin ahye ana se ebema ne ekufa yare ho woni mu no ebebubu na asai na akola na nya yare ana ye ma ye mba aduane a ye hwe sa niema na ana se ye hwa ende ende ya se ye hwe ende no de ebetene ebema ye hu se se ye hwe se ye ma ye mba aduane a mede mani ahoɔden ben na wom eden mmoa na aduane benya ewo me ba ridie mu eden na aduane betimi ayama me ba no ewo ne ridie mu me pa mo cho eno fitin de ko yenhwe eno afenso yemba no abra omu nyi no yene omutena sei ye tete omu no eban bo ben ye de ma won bebia odi agro na hot sei niam egu ho akwala no betimi apatre no wahwe fom na ne nan ye bu ana blade panie kerosene parazone ye de siwo ye de gu nkwala bottle mu akwala no wafa wanom enu nyina ye se ye hwe